Okay, come on, let's get her over here. Watch that saline, please.
Stabilize her head down.
Okay, I'm ready.
On three. 1, 2, 3.
Okay, what have we got here, people?
Here's the bottle. Looks like she drank about 20 cc's. Her pulse was 180 a week just before we got here.
Now, this is real toxic stuff. What happened here?
She was playing tea party. She drank some.
Okay.
Baby looks good.
Healthcare professionals in the emergency room have seen it all.
All right.
They're ready for any situation that comes in.
Sounds good bilaterally. Good placement, people. Let's get her on the monitor.
Doctor, we have poor capillary refill.
Yeah, her pulse is 180 and weak. She's in shock. She's not perfusing well.
But when the emergency involves a child or an infant, there's often an extra feeling of urgency.
Okay, I've got about 24 kilos.
Okay, let's give her 480 cc's of normal saline bolus IV.
And cut.
These folks are actors, but you're not. You live in the real world, where at any time or place, you may face a life-threatening emergency where CPR can make the difference between life and death. Would you know what to do in such an emergency? Hi, I'm Catherine Whiten, and this American Heart Association Watch Then Practice Rescue Program will show you what to do. You'll learn CPR techniques for infants under 1 year old and children up to 8 years old. You know, there are 3 types of life-threatening emergencies you're likely to see with infants and children: respiratory arrest, cardiac arrest, and choking on a foreign object. Using good judgment and common sense can prevent many causes of respiratory or cardiac arrest. You can't prevent them all, but you can recognize the symptoms. With this knowledge, you'll know how to react. You can recognize respiratory arrest if a child is unresponsive and not breathing. When a child is not breathing, the brain and heart can't get oxygen. The child becomes unresponsive, and if nothing is done, the child will die. When cardiac arrest occurs, the heart stops pumping. The infant or child becomes limp and lifeless. There is no response, no normal breathing, no sign of circulation. Finally, a baby or child may be choking with something blocking the airway. We call this a foreign body airway obstruction. If the airway is completely blocked, the brain and heart can't get oxygen. You can recognize this when a baby or child can't cough, talk, or breathe. You may hear weak, high-pitched sounds, and the lips and fingernails may turn blue. When you see these life-threatening emergencies, you can greatly increase a young victim's chances for survival if you act quickly and begin what the American Heart Association calls the chain of survival. The infant and child chain of survival has 4 links: prevention of cardiac arrest, early CPR, early access to emergency care through 911, and early advanced care. The first link in the infant and child chain of survival is to prevent the most common causes of cardiac arrest: sudden infant death syndrome, or SIDS, injuries, and choking. SIDS is the leading cause of cardiac arrest and death in infants between 1 and 6 months old. You can reduce the risk of SIDS by making sure your baby sleeps on the back or side rather than on the stomach. An easy way to remember this is to place your infant back to sleep. Car crashes take many young lives. Most deaths of car passengers can be prevented if everyone in the car buckles up. Make sure you know how to properly install and use child safety seats and other restraints appropriate for the age and size of your child. And if your child is under 12, the safest seat is in the back. Supervise your children at play, especially near swimming pools and busy streets. Be especially careful at bath time. An instant of carelessness can result in drowning. When your child is bicycling, make sure he wears proper headgear and knows the rules of the road. Prevent poisoning by keeping household chemicals and medicine locked up and out of reach. Post the Poison Control Center number near your phone. Use gates on stairs and windows to make sure your toddler is safe from falls and dangerous areas. Death from choking can be prevented. Don't allow your child to play with toys, food, or anything that's small enough to fit inside the tube from a standard roll of toilet paper. These are just a few steps you can take to prevent respiratory and cardiac arrest in your child. You'll find more information in your textbook. But if the unthinkable should happen, remember that the second link in the chain of survival is early CPR. Early action saves lives. The earlier you give CPR, the greater the chance of survival. That's because CPR keeps oxygen-rich blood flowing to the heart and brain until normal heart action and breathing can be restored. The third link is to phone 911. If someone else is around, send that person to call 911 as soon as you realize there's an emergency. If you're alone, you should provide about 1 minute of CPR, then call 911. The fourth link in the infant and child chain of survival is early advanced care provided by paramedics, nurses, doctors, and other healthcare professionals.
All right, what we got here, people?
Amy, it's time for your bottle. Amy, wake up, baby. Wake up, sweetheart.
Would you know how to help Amy? You can breathe life into an infant who's not breathing. Start by checking for responsiveness. Gently tap the baby's foot and shout for help.
Baby, are you okay? Are you okay? Help, somebody help.
Next, open the airway. If you don't suspect a head or neck injury, gently tilt the head back and lift the chin with one hand while pushing down on the forehead with your other hand. We call this a head tilt chin lift. In infants, the head should be tilted back only slightly. If you tilt too far, this may obstruct the airway. If you think there might be a head or neck injury, you should open the airway using what we call a jaw thrust. We'll show you how to do that a little later in the program. Next, put your ear over the infant's nose and mouth, then look, listen, and feel for breathing. If the infant is not breathing, you'll need to begin rescue breathing immediately. Give 2 slow breaths. While holding the airway open, take a breath and create a seal over the baby's nose and mouth with your mouth. Deliver each breath over about 1 to 1.5 seconds. Make sure the volume and pressure of each breath makes the chest rise. If the chest does not rise when you deliver a rescue breath, reopen the airway, reposition the head, and try again. Your goal is to deliver 2 effective breaths as you start CPR. Now it's your turn. Using an infant mannequin, practice checking for unresponsiveness, shouting for help, opening the airway, checking for breathing, and performing rescue breathing. Earlier, we saw how to perform a head tilt chin lift to open the airway. But if you think there might be a head or neck injury, you'll need to be more careful when you open the airway. Use what we call a jaw thrust instead of the head tilt chin lift. Without moving the head, place the fingers of both hands under the angle of the jaw and lift the jaw forward and upward to lift the tongue away from the back of the throat. You can use your thumbs to help open the mouth. Because the jaw thrust is less commonly needed, we will not practice it in this course. After giving 2 slow rescue breaths, check for signs of circulation. Quickly determine if the baby is breathing normally, coughing, or moving. With your ear next to the baby's mouth and nose, look, listen, and feel for normal breathing or coughing. Scan to look for body movement. This should take no more than 10 seconds. If there are no signs of circulation after your initial rescue breaths, you'll need to begin chest compressions. Here's how. Draw an imaginary line between the baby's nipples, then place 2 fingers of your free hand on the breastbone, about 1 finger's width below that imaginary line. Be careful not to press on the very bottom or tip of the breastbone. Next, press the chest downward, about 1/3 to 1/2 the depth of the chest. Do it at a rate of at least 100 times a minute. Remember to release the pressure completely between compressions, but don't lift your fingers off the chest. After every 5 compressions, give 1 rescue breath. Once again, it's your turn. Using an infant mannequin, practice performing 2 rescue breaths, checking for signs of circulation, and performing several cycles of 5 chest compressions and 1 breath. Now let's put these skills together in a complete sequence.
Baby, baby, are you okay? Are you okay? Help, help, somebody help.
Open the airway using a head tilt chin lift. Put your ear over the child's nose and mouth, then look, listen, and feel for breathing. Give 2 slow rescue breaths, each lasting about 1.5 seconds. After giving 2 slow rescue breaths, check for signs of circulation. If you find no signs of circulation, begin chest compressions. After about a minute or so of CPR, about 20 cycles of 5 compressions and 1 breath each, check for signs of circulation. Check to see if there are any signs of normal breathing, coughing, or movement. If you're alone, remember that no one has called 911, so after about 1 minute of CPR, you should make the call yourself.
Hello, 911. I have an infant in cardiac arrest. I've been doing CPR.
If your child is not injured, you may carefully carry your baby with you to the phone. After your call, resume CPR. As you continue CPR, check for signs of circulation every few minutes. If there are signs of circulation, some breathing effort, coughing, or movement, but still no normal breathing, continue rescue breaths at a rate of 1 breath every 3 seconds until help arrives. Now practice the complete sequence. Check for unresponsiveness, shout for help, or send someone to call 911 if possible. Check for breathing, perform rescue breathing, check for signs of circulation, perform 20 cycles of 5 chest compressions and 1 breath, and check for circulation after 1 minute. If you're alone, then phone 911. Choking is a typical emergency for a baby. If something becomes lodged in his airway, he can't breathe. When the airway is completely blocked, he can't make any normal sound, no talking, no loud coughing, though you might hear some tiny squeaks. You must immediately try to remove the object. First, with one hand, turn the infant onto the stomach with the head down, lower than the body. Make sure to support the jaw, neck, and head. You can rest your arm on your thigh to support the weight. Deliver 5 sharp blows to the middle of the back with the heel of your free hand. Still supporting the head and neck, turn the infant onto his back. Position 2 fingers over the lower half of the breastbone, 1 finger width below a line between the nipples. Put your fingers over the same place that you would to perform chest compressions for CPR. Be careful not to press on the very bottom of the breastbone. Now, deliver 5 chest thrusts. Alternate 5 back blows and 5 chest thrusts until the object comes out or the baby becomes unresponsive. If the baby becomes unresponsive, shout for help and send someone to call 911, but you must begin CPR. When you open the airway to give a rescue breath, look in the mouth for the object. If you see it, remove it. Do not perform a blind finger sweep. Otherwise, continue CPR. If you are alone, after about a minute or so of CPR, call 911 yourself, then continue CPR. Now, using an infant mannequin, practice relieving a foreign body airway obstruction.
Come on, Katie, get up. Come on, sweet baby, get up.
Eleanor, what's wrong?
It's Katie. She fell off her bike.
Katie.
She was showing
Katie,
us she
honey.
could ride and she fell.
Jesse, your phone. Call 911.
dear.
So what would you do to help Katie? As we did before, first check for responsiveness.
Are you okay? Are you okay? Help! Somebody help!
Next, open the airway and check for breathing. In our drama, the rescuer was careful not to move Katie because she may have had a head or neck injury. Our rescuer used a jaw thrust to open the airway. We'll show you how to do that in just a moment. For now, we'll practice rescue breathing using the head tilt chin lift. Place one hand on the forehead and apply firm backward pressure with your palm, tilting the head back. Put the fingers of your other hand under the bony part of the lower jaw near the chin. Then lift the jaw up to bring the chin forward. Be careful not to tilt the head back too far or press the soft tissues over the throat, since this may block the airway as well. With your ear over the mouth and nose, look for the chest to rise and fall. Listen for air escaping and feel for the flow of air. If there is no airflow, begin rescue breathing immediately. Take a deep breath, pinch the child's nose, and place your mouth over the child's mouth and create a seal. While keeping the airway open, give 2 slow breaths, each lasting 1.5 seconds. Be sure the child's chest rises when you blow. Stop blowing when the chest begins to rise. The rise means oxygen-rich air is getting into the child's lungs. If the chest does not rise, you should reopen the airway and try again. Your goal is to give 2 effective breaths as you start CPR. Now it's your turn. Using a child mannequin, practice checking for unresponsiveness, shouting for help, opening the airway, checking for breathing, and performing rescue breathing. As we learned earlier, if you think there might be a head or neck injury, you'll need to use a jaw thrust instead of the head tilt chin lift to open the airway. Without moving the head, place the fingers of both hands under the angle of the jaw and lift the jaw forward and upward to lift the tongue away from the back of the throat. You can use your thumbs to open the mouth. If breathing is necessary, close the nostrils by placing your cheek tightly against them. After giving 2 slow rescue breaths, check for signs of circulation. With your ear next to the victim's nose and mouth, look, listen, and feel for normal breathing or coughing. Scan to look for body movement. This should take no more than 10 seconds. If there are no signs of circulation, begin chest compressions. While keeping the head tilt with your hand closest to the child's head, place the heel of your other hand on the lower half of the breastbone. Be careful not to press on the very bottom of the breastbone. And make sure that there is firm support beneath the child's back. Kneel upright so your body and shoulders are directly over the chest with your arms straight. Position your body so your shoulders are directly above your hand. You should be looking straight down at your hand. Holding your arms straight, compress the chest about 1/3 to 1/2 the depth of the child's chest at the rate of about 100 compressions a minute. Be careful to release the pressure completely between compressions, but don't lift your hand off the chest. After every 5 compressions, give 1 rescue breath. It's your turn now to practice. Give 2 rescue breaths, check for signs of circulation, and perform several cycles of 5 chest compressions and 1 rescue breath using a child mannequin. Let's put the sequence together. First, check for responsiveness.
Are you okay? Are you okay? Help! Somebody help!
Next, open the airway and check for breathing. If there is no normal breathing, give 2 slow rescue breaths, each lasting 1 to 1.5 seconds. Look for the chest to rise. After 2 effective breaths, check for signs of circulation, normal breathing, coughing, or movement. If there are none, begin chest compressions at the rate of about 100 compressions a minute. After every 5 compressions, give 1 slow breath. Check again for signs of circulation after about a minute of CPR. Phone 911 if no one has done so, and continue CPR.
Yes, I have a child in cardiac arrest.
Now it's your turn to practice the entire sequence. Check for unresponsiveness, shout for help or send someone to phone 911, open the airway and check for breathing, give 2 rescue breaths, check for signs of circulation, and perform chest compressions and rescue breaths at a ratio of 5:1. Check for signs of circulation after 1 minute and phone 911 if no one has done so. Continue CPR until help arrives. If signs of circulation return and the child is breathing normally, place the child on his side and continue to monitor the child until advanced life support arrives. This is called the recovery position.
Slow down. Hey, Squirt, watch it. What's wrong with you? Mom, come quick. Something's wrong with Georgia.
What are you two doing? Georgia, what's wrong? Are you choking? Can you talk? Hold still, honey. I'm going to help you.
Georgia couldn't talk or make any sound because the candy was completely blocking the airway. In this scene, you saw Georgia place her hands around her own throat. This is the universal sign that she's choking. If you're choking and can't breathe, this sign tells others you need help. If you see a child making this gesture, here's what you should do. Ask the person, are you choking?
Are you choking?
Ask the person, can you speak?
Can you speak?
If the child can't talk, cough, or breathe, say that you will help and stand or kneel behind the victim.
Okay, I'm gonna
Make a
help you.
fist with one hand. Place the flat thumb side of your fist on the abdomen just above the navel and well below the breastbone. Be careful not to press on the breastbone itself. Grasp your fist with the other hand and give quick upward thrusts into the abdomen. These forceful thrusts are sometimes known as the Heimlich maneuver. Each thrust should be given forcefully with the intention of pushing the object out. If the child becomes unresponsive, send someone to call 911, but you start CPR. Each time you open the airway, look for the object, and if you see it, remove it. Do not perform a blind finger sweep. If you're alone, perform CPR for about 1 minute before phoning 911 yourself. Now, practice relieving a foreign body airway obstruction on a child mannequin. The chain of survival for infants and children: prevention of cardiac arrest, early CPR, early access to emergency help by phoning 911, and early advanced care. You know how to reduce the risk of respiratory and cardiac arrest by reducing the risks of SIDS, injuries, and choking. You know how to perform CPR and when to phone 911 to get advanced care. You also know how to remove an airway obstruction. With this knowledge, you can make the difference between life and death. To keep your skills sharp, review the steps of CPR several times every year. Take an American Heart Association renewal course at least every 2 years. And encourage your family and friends to learn CPR.